So 4 new community cases overnight. One of them is a person who recently travelled from Dili, from Timor-Leste, had 3 negative tests in hotel quarantine and then has tested positive 5 days after leaving hotel quarantine. So we're just working through whether that's late shedding or whether it is a case. So we're just working that through with that individual and her family at the moment. Now, our other 3 cases are in 2 separate, unrelated clusters. So one is a gentleman in his 30s who lives in Eaton Hill, who works for one of the aviation training sites, and he would have come into contact with overseas pilots and so forth. So we're just working through, and I should get the whole genome sequencing later today to help with that. But he, as soon as he developed symptoms, got himself tested, confirmed positive, and has now been admitted to hospital. Then we've tested the 2 household members in his own house, and one of those is tested positive, so she's now in hospital as well. The 3rd person at this stage is negative. So there are a number of exposure sites, including a childcare centre, so the Mother Duck childcare centre, so we're just working that through, and there are a few other exposure sites, so if people could please look on the website. But most importantly of all, any symptoms at all, come forward and get tested. Then the other case, the 4th locally acquired case, is a gentleman who works as a truck driver. So we're just working through with him where he might have acquired the infection. He came forward and got tested after he'd had some flu-like symptoms and has tested positive, but he was out in the community for 8 days while infectious. So we're just working that through. Now, he stayed at 3 different places, 2 hotels in Spring Hill and a boarding house in Stevens Road in South Brisbane. So we're working through with the managers of those 3 facilities as to who else was in those accommodation venues while he was there, and organising quarantine for all of those people. And we're continuing to work with him as to what other sites he's been at while infectious, but there's been a number that we've already been made aware of. That's why it's absolutely critical, please, anyone particularly in Brisbane or that Moreton Bay region, particularly that western part of Brisbane, any symptoms at all, please just come forward and get tested. That's absolutely critical. And then the other thing I need everyone to do is immediately, if you haven't got vaccinated yet, today is the day to come out and get vaccinated. We know that it takes a while to get full immunity, but even with the very first dose, you get some immunity, 2nd dose more, and then 2 weeks after that 2nd dose, you get your maximum immunity from the vaccine. So it's really, really important. We don't know where our next case is going to come from. It could come at any time, so don't wait for an outbreak. Come forward wherever you are in the state of Queensland and get vaccinated if you're 12 years of age or older. It's absolutely critical. I can't overemphasise how critical it is to just get vaccinated. And thank you to those many, we're well over 1.9 million Queenslanders who've had 2 doses of the vaccine. So that's fantastic. We just need all Queenslanders 12 years and over to come forward and get vaccinated. And we've got so many sites. Genuinely, there are so many places. If there's a big queue in one site, there'll be room somewhere else. So we're here today at the Brisbane Convention Centre in South Bank, but I know there's plenty of capacity at Boondall, there's plenty of capacity throughout the state. Our pharmacies are doing a fantastic job. They are ramping up so quickly with the Moderna that they've got. Our GPs also are ramping up. So there will be somewhere that can vaccinate you today, so please do that.